Thank you very much for joining us.
6 months ago, none of us could have imagined how our world and our lives would be thrown into turmoil by this new virus. The pandemic has brought out the best and the worst of humanity.
We are ready from the technical side. We will go first.
We all want this to be over. We all want to get on with our lives. But the hard reality is, this is not even close to being over.
Once again, journalists, that if they wish, they can.
The critical question that all countries will face in the coming months is how to live with this virus. That is the new normal. Many countries have implemented unprecedented measures to suppress transmission and save lives. These measures have been successful in slowing the spread of the virus, but they have not completely stopped it. Some countries are now experiencing a resurgence of cases as they start to reopen their economies and societies.
Yes, Konstantin Ionatamishvili.
Time after time and country after country, what we have seen is this virus can be suppressed if the governments are serious about the things they have to do, their share, and if the community can do its share. So while doing our best to find a vaccine, which is the right thing to do, our advice from WHO is we should do everything we can using the tools we have at hand.
Thank you, Dr. Ryan and Dr. Tedros, for this answer.
And with 10 million cases now and 500,000 deaths, unless we address the problems we have already identified as WHO, the lack of national unity and lack of global solidarity, and the divided world, which is actually helping the virus to spread. As I said in my speech, the worst is yet to come.
Thank you, Dr. Tedros, and thanks to Michael for this.
What you have to do is push the disease down to the lowest possible level. And communities have made a huge sacrifice for that to happen. They've stayed at home, they've stayed away from their families, they've contributed tremendously to suppressing infection. And what public health authorities have needed to do is to put in place the right public health surveillance in order to take advantage of that. So as the restrictions are lifted and as we see small clusters appear, the public health authorities can react quickly.
You will need to unmute yourself.
It can be increasingly difficult to apply this comprehensive approach as transmission increases, but it's not one activity alone. It is not contact tracing alone. It is not case finding alone. It is not physical distancing alone. You've heard the Director General, you've heard us say this all the time, but it's worth repeating because there tends to be a focus on a particular intervention, but it needs to be all of the above.
Brussels time, and we have with
we will be sending a team next week to China to prepare for that. And we hope that that will lead into, understanding how the virus started and what we can do for the future to prepare.
This will conclude